All right, people, welcome to Frank Analysis. I'm your host, Franco. We have a lot to unpack here today. I want to give a shout out to Anthony Reyes. Me and him have been discussing. We did this research together, and he's been pointing out a lot of stuff that I was also thinking about regarding COVID and some commentators and journalists that we follow who do great work. So we're gonna get into Avril Haines, and people have done a fantastic job covering her. And others of who Biden picked to be on his cabinet. We have Jimmy Dore, the Convo Couch, Richard Medhurst. They did a fantastic job bringing up her past war crimes as well as the past war crimes of Anthony Blinken, and how much they want to get into more war. And how likely they are to do it. Their ties to lobbyists, their ties to big tech, their ties to intelligence. But they have not gone into enough depth with the ties to COVID. There's a disconnect right now with people who do fantastic work like the Gray Zone, like Jimmy Dore. There is a disconnect with their work and the work of the last American vagabond. People like Whitney Webb, Derek Bros, Ryan Christian, they have been doing fantastic work on Operation Warp Speed and the ties with intelligence in the military. And there are ties with Avril Haines, who Biden just appointed to be in his administration as the director of national intelligence. This woman, the more you find out about her, the more you realize how much of a spook she is. She is the spook of all spooks. So yeah, there's a lot to unpack here. But first, I'm gonna get started with some stuff that other channels have already talked about. I recommend you guys check that out. I recommend for you guys to go check it out. Just because I'm giving some critiques here, it doesn't mean that they don't do fantastic work. I've complimented the Convo Couch, Gray Zone, Jimmy Dore. I've complimented their work. Richard Medhurst does amazing work. They all do amazing work. But when it comes to COVID, some of these channels are believing some of the mainstream media narratives here. And it's disappointing to see because they did a fantastic job questioning the narrative on Russiagate. And these people, they do way better analysis than channels like TYT, Humanist Report, and Kyle Kalinske even. I'm just talking about COVID in particular. There hasn't been really enough coverage by these channels. But I guess because these people don't have that much of an understanding on biological phenomena, like molecular biological phenomena, microbiological phenomena. They seem to put their trust in what the mainstream medical news says about this, like what the CDC and the WHO are saying. Their focus is more geared on foreign policy, or calling out the mainstream news like what Jimmy does. They're not focusing their in-depth research on the lies that are being told to us by the CDC and the WHO, at least not in depth. I know Jimmy has called out Fauci. I know Convo Couch has done so as well. But anyway, we'll get into Haines here right now. All right, so this is what Convo Couch reported on. Like, this is stuff that I recommend you guys check it out. But this is stuff that's more known to people about Haines. So just for the people who don't know, I'm gonna read what was written here on this RT article. It says, though Biden assured the public that people will be able to take her word regarding Haines aided in covering up the CIA's hacking of Senate servers in 2014, as the Intelligence Committee was compiling a report into the agency's use of torture. Haines also helped craft Barack Obama's controversial drone warfare policy, which resulted in the deaths of hundreds of civilians in multiple countries, including at least one American citizen. And Richard Medhurst went deeper into this, into how Haines played a role in planning the drone program under the Barack Obama administration. So I recommend checking out his video. Now, this is what Richard Medhurst also went into. This is from News Chant, and it says the selection of Miss Haynes, who can be the primary girl to function the nation's prime intelligence official, prompted concern from some human rights teams, which questioned her position because the architect of Obama administration's program concentrating on terrorists with drones, a few of which killed civilians. A few of which, but I mean, Richard goes into it, but I mean, come on, like it's killing people. They're war crimes. But her defenders argue that Miss Haynes helped put in place safeguards. Yeah, that's bullshit. Safeguards on using drive or better transparency for the drone program. Look, she's a war criminal, and she's going to be in Biden's administration now. Biden, who is to the right of Obama, and he's definitely going to escalate tensions with countries in the Middle East. And again, they do it for profit, for the fossil fuel industry, for the Wall Street, for the military-industrial complex. We're not there for stability. We are there because these politicians want their donors to profit so that they can profit later on. All right, so I went over this information that these other commentators covered on. Again, they did a fantastic job, but now check this out. This is information that me and Anthony got into from Whitney Webb's work, as well as Derek Bros and his coverage on Event 201. Jason Burmis has also covered Event 201. Steve from Slow News Day as well. But Haynes was a consultant for diversity, or a diversity consultant for Palantir, which is a public American software company. Now, what does diversity consultant mean? It means that your role is to ensure that your company's culture and practices are fair and inclusive. So she was in charge of, the inclusivity of Palantir, making sure that they are inclusive. But, are you gonna trust their agendas if they're, a corporation that are more interested in profit? And again, she's a spook for intelligence. So this is from an interview that on LouRockwell.com, he interviewed Whitney Webb, and they discussed about Palantir. So he also described what Palantir is in his article. Palantir, a company called Palantir, was given the contract to come up with the vaccine allocation strategy and determine the critical populations each vaccine should be distributed to. Palantir, founded by Peter Thiel, was initially funded by QTL, the CIA's venture capital arm. The CIA was its only client for the first 3 years of its existence. At present, Palantir is a contractor to 17 U.S. intelligence agencies and also the U.S. military. The company is also in charge of COVID-19 data under the auspices of the HHS. Hospitals must now report their COVID-19 data to Palantir or lose their Medicaid and Medicare funding. Palantir is also involved in things like predictive policing. I recommend that interview for people. Go ahead and check that out. So she was the diversity consultant for Palantir, which means that she was probably consulting with them in this program about Palantir's role with the vaccines, about which places need the vaccine the most vulnerable people for COVID-19, which has been discussed in several studies, is minorities, working class people, and minorities. So Melinda Gates, this is an interview that she had on Time. She said that when she was asked about who needs it after healthcare workers, she said in the U.S. that would be black people next, quite honestly, and many other people of color. They are having disproportionate effects from COVID-19. From there, people with underlying health conditions, and then people who are older. those are the ones who all need it first. We also need to think about essential workers who are keeping our grocery stores open for us so we can buy food, or who are making sure that food moves through the warehouses. So this would not be the first time that the Bill and Melinda Gates Foundation have used their vaccines on poor people. They've done this plenty of times in other countries. I have a Gray Zone article up here for you guys to check out, which talks about Bill Gates, which talks about how Bill Gates is actually more concerned with profit than actually helping people with actual public health. And they bring up several pieces of evidence of what they did around the world. So let me just bring it up for people who don't know. The Gates Foundation has helped engineer global health policy for poor countries for over 20 years, working mainly in Africa and South Asia. Its close relationship with the drug industry seems to have colored that work. While the foundation's mission statement reads, "We see equal value in all lives," and exploration of this recent history proves otherwise. The foundation appears to see the global south as both a dumping ground for drugs deemed too unsafe for the developed world and a testing ground for drugs not yet determined to be safe enough for the developed world. The so-called flagship of Bill Gates / the WHO African vaccine program is the diphtheria tetanus pertussis DTP vaccine. It is a bundle of 3 immunization shots given to virtually every child on the African continent, but not currently administered in the US or in most other developed nations. As far back as 1977, a study published by British medical professionals in The Lancet established that the risk of the whole cell pertussis jab used in the DTP vaccine are greater than the risks associated with contracting wild pertussis. I don't know how to pronounce it. After mounting evidence linking the drug to brain damage, seizures, and even death, the US and other Western countries phased it out in the 1990s and replaced it with a safer version called DTAP. That did not contain the whole pertussis cell. However, African nations are still being financially incentivized to continue using the out-of-date, deeply dangerous DTP vaccine, with Gavi making DTP a priority for African children. Shockingly, a 2017 study founded by the Danish government concluded that more African children were dying at the hands of the deadly DTP vaccine than by the disease it prevented. The researchers examined data from Guinea-Bissau and concluded that boys were dying at almost quadruple 3.93 the rate of those who had not received the shot, while girls suffered almost 10 times 9.98 the death rate. Yet these staggering numbers have not stopped the Gates Foundation from spending millions annually to push the DTP vaccine onto African healthcare system. That's such a effed up picture right here of Bill Gates administering the vaccine onto these children, and then a lot of them ended up suffering even more than they were already suffering. I mean, this guy is not a freaking doctor, and then they ask him for advice. No, it doesn't matter that he's a philanthropist. No, this article also talks about his role in the mainstream media and how he's bought out the majority of mainstream media, and how the MS in MSNBC stands for Microsoft. And now Bill Gates is playing a role in the development and the manufacturing of the COVID-19 vaccine. And they're going to target the poorest regions of the US. That's what it appears like it's going to be. It might be that. I'm not saying that it'll be for sure, but it's looking that way. Not only that, but in historical Black colleges and universities, they're taking an active role in COVID-19 testing and vaccine efforts. This is an article by Education Dive. James Hildreth, president of Meharry Medical College, hopes the coronavirus vaccine under investigation by his historically Black institution in Nashville will help bring an end to a virus that is disproportionately killing Black Americans. His goal is to enroll at least 500 participants in a clinical trial of the drug, many of them Black, But first, he has to convince them it's safe. Black people have been underrepresented in U.S. coronavirus clinical trials to date, an imbalance researchers attribute to a deep-seated suspicion of the medical establishment stemming from past abuses. So I mentioned on this show, when I was on with Stephen Glory, when we did a live stream, when we were talking about Operation Warp Speed, we talked about how the vaccine that they are developing has a 90.5% success rate. The Last American Vagabond has several streams, and he shows from the scientific literature how the vaccine that they're developing through Operation Warp Speed has a 90.5% success rate as well. And this is from the Swiss Policy Research, and they cite their sources as well over here. So it says the lethality, according to the latest immunological studies, the overall infection rate of the COVID-19 in the general population is about 0.1% to 0.5% in most countries, which is comparable to the medium influenza pandemics of 1957 and 1968. So I'm just clicking on that for you guys to see. So based on their research here, or the research that they gathered globally, if you're below 70 years old, you have a 0.05% chance of dying from it if you get it. Which cites a study from the World Health Organization itself. So the vaccine that they're developing, there seems to be a strong motive to try to test it on poor people, and they have done it before. Just like I showed you, they've done things like this before with other diseases in the global south on children. So based on this information, my guess is that Haynes, she was behind the planning of the distributing the vaccine on minorities first, when she served as the diversity consultant of Plantier. Now, I brought up Event 201. I brought up Operation Warp Speed. Haynes was a part of Event 201. And for people who don't know what Event 201 is, it is a pandemic tabletop fictional exercise that was hosted by the Johns Hopkins Center for Health Security. And this was done in partnership with the World Economic Forum, the Bill and Melinda Gates Foundation, Johnson & Johnson, and there were many high-ranking officials of the WHO and the CDC that attended. People like George Gao of China, who's a virologist and the director of the Chinese CDC. And this was supposed to be an exercise of how prepared we are for a pandemic. The event was held in October 2019. This was over a year ago, before the actual pandemic hit. And in it, they talked about how they were going to have the government and social media companies work together to block misinformation and take down channels. So the stuff that they talked about in this simulation ties in so much with Operation Warp Speed. So for people who don't know what Operation Warp Speed is, it's a public-private partnership that was launched by the Trump administration to rapidly develop and distribute a COVID-19 vaccine. Now, keep this public-private partnership phrase in mind, because I'm going to bring this up again. The CIA and the military are heavily involved in this operation. This is a paragraph from Whitney Webb's article explaining Operation Warp Speed. You can find this on Unlimited Hangout and also on the Last American Vagabond website. All right, so here is the paragraph I wanted to read to you guys. For instance, Stat News noted last week that Operation Warp Speed looks a lot more like a military operation than a science project, adding that roughly 60 military officials, including at least 4 generals, are involved in the leadership of Operation Warp Speed, many of whom have never worked in healthcare or vaccine development. That report also pointed out that just 29 of the roughly 90 leaders on the chart aren't employed by the Department of Defense. So that's something that we need to be wary about. Why does the military need to be involved with this? So going back to Event 201, Haynes, she played a key role in that simulation. And in it, she kept uttering the same phrase. public-private partnership. They also talked about how they were going to censor disinformation, disinformation that doesn't align with their information, not objective information, but they said their information. So she also talks about how in this event, she also talks about how the government has to work with telecommunication companies so that they can distribute the type of information that they want to distribute to the public, not objective information, but information that they want. I've talked on this show about how the solution to fake news is not less speech, but more speech. People have the right to lie, and people also have the right to expose lies. It shouldn't only be the right for authorities to expose lies, because how do you know that they're not lying to you?
Okay, sure. I mean, I think it's just in terms of the precise question being asked, it's clear that having everybody go it on their own is not going to be the most effective answer, right? So I absolutely agree with the comments that have been made that we need to have some kind of international mechanism for coordinating what it is that we would be doing, also for collecting information, also for understanding what the resources are that are available through international mechanisms to execute on that allocation and coordination. I think it's challenging to set it up in a way that says that international mechanism has to be the body that decides in all circumstances what the allocation is. In other words, I think states are going to want to be able to decide for themselves on, in some circumstances, some of the issues that are relevant. So one of the challenges will be ensuring that you're using an existing mechanism, and I think Sophia's right about the UN as being sort of the base of operations in a sense, both for the funding but also for a whole series of other issues that you would be looking at for allocation, coordination, et cetera. But then making sure that states are stepping up to actually tell people what it is that they're doing, what their decisions are in that context, and creating transparency about what the proper allocation should be for containing this issue so that there can be pressure put to bear on ensuring that states are actually doing what the larger plan needs to be in that context.
Can I ask a follow-up question? If there is a centralized stockpile developed, either at the WHO or perhaps somewhere else in the UN system, if you were going to suggest that, or some other entity, how much can you imagine states contributing of the supplies that are being made in their own countries? Is this a 1% allocation, 20% of the supply that they're making? We've already heard from George that China's not making nearly enough medication to take care of China at this point. So what is the desired end state here? Can you, from a state security perspective, if someone who's worked at the top of government, what do you imagine states who have this medication doing?
I mean, I think the percentage will depend on the details, right? And what it is that you're capable of actually producing in the context of the particular crisis. And I don't know how much we're able to produce under this circumstance. I think there should be, and there would be, from a public perspective and a public health perspective, right, enormous interest in promoting an allocation to international efforts that would actually contain the issue as quickly as possible, right? And that should be the focus for everybody in the sense of that's what's going to actually help you prevent the downstream impact of what the trajectory holds for us. So the question is, can you, through this international mechanism, really promote commitments to doing this as quickly as possible and give people a sense that actually if they contribute more, that they will have a better chance of protecting their own populations and their country's security.
Okay. Another number of comments. You all just jump in.
So I would absolutely agree with the comments that were made by Chris and Jane and Tim in terms of how we would think about this moving forward. I think the other things that I would just add into that is that it seems to me that travel bans, one of the concerns with that is also in relation to not just the economic consequences, but your ability to actually respond effectively to the health issue to begin with. So that clearly has to be a factor that should be addressed in the context of analyzing what the right balance is. In addition, I understand my staff has told me that there is concern from the State Department and the White House about instability that would be essentially breaking out potentially in South and Central America as a consequence of this. And that's obviously another issue that we would want to factor into what would be the right balance for travel. But the final thing I'd just say is that in the United States, certainly we have experienced in the past political pressure to basically stop travel when there's panic in the country. And one thing that I think we learned from the Ebola crisis in particular was that stepping out early, communicating as effectively as possible with the public about what it is that you're doing, what informed travel should and should not be, and so on, and but also having a policy and establishing that policy early so that states and others can understand this is how we're supposed to be sort of communicating and working with the federal policy on travel on these issues. And I think internationally you might have a similar scenario in which the World Health Organization, UN, and others are saying this is what we believe to be the best practices for travel. That can be very helpful in trying to manage what the sort of public panic might be in that.
So you would advise a common international approach to this, to the extent that that's possible?
So I've been told that some governments have now fallen and that others are teetering and that there's widespread social unrest and governments are asking for emergency aid to stabilize their economies. And I think this highlights, from my perspective, there's the existing need for funding that relates to essentially the stabilization of government so that they can continue to provide services, which frankly still contributes to the point that Jane made, which is that we need to prioritize bringing the pandemic under control. And if those governments fail, that will actually make it much harder for us to do that as we're moving forward. I think in addition to that, there's likely to be significant amounts of other forms of security unrest, essentially, that can be concerning. And that can come in the form of, terrorist groups or others taking advantage of the situation, but it can also come in the form of, famines because of the fact that there are no longer people who are supposed to be providing food in the chain there because of, disease outbreaks in an area or things along those lines. And so I think there's a need to focus on assistance, humanitarian assistance, other types of assistance that can help to prevent sort of widespread death and destruction in certain areas where we see it and where it's actually going to make it more challenging in particular to address the pandemic as it continues. But there's also the need, from my perspective, to be looking for the next few months. If we still believe that a vaccine is not going to be available for many, many months to come, then we're going to continue to see a trajectory of an expansion of this. And as a consequence, we're going to want to be able to make sure that we actually have the infrastructure in place to deliver the kind of assistance that we need in these different areas across the board so that we can actually continue to manage the situation, not just economically, but political instability and violence that might outbreak as a consequence as well.
Thank you. Okay. Final comment, Tim? Oh, sorry.
Oh, sorry.
Avril?
But something that I mentioned earlier, too, that's not up there, I think, which is basically ensuring that we actually have on the list of things that would receive funding, infrastructure that would allow for both public and private sector help for humanitarian assistance that would then actually help to provide, to address the challenges that are exacerbating the, the spread of the disease under certain circumstances.
Got it. Yeah.
Real quick, it may be inherent in the prop-up of industry, but trade associations should be added to that. There's some really effective trade associations today, HIDA being one of them, that is bringing manufacturers and distributors together.
Thank you. Avril?
I very much agree with that. So, I think I agree with a lot of what's been said. I'd just add to it maybe by saying that I think one of the things we want to do is work with telecommunication companies to actually ensure that everybody has access to the kind of communications that we're interested in providing, because that's going to be critical for dealing with, obviously the explosion of the disease. And then another issue, I suppose, is just through that, if you have a trusted source, I believe in the idea that we shouldn't be trying to control communication, but rather flood the zone, in a sense, with a trusted source that then is influential community leaders as well as health workers, as Brad noted, and others on these issues in order to try to amplify the message that's coming through. And I think Tim's absolutely right. I certainly seen the value of communicating constantly on these issues so as to continue to deal with, sort of the vacuum that can be created in this circumstance. But then also with the comments made about the fact that for all of the disinformation that will be put out, it's going to be important to actually have a response to those questions and to those concerns, as Stephen said. And I understand from staff that actually there are also intelligence sources identifying multiple foreign disinformation campaigns. and so on. But it's all a part of a larger piece, which is to say that every time there is something that comes out that is in fact false information that is starting to actually hamper our ability to address the pandemic, then we need to be able to respond quickly to it.
So, thanks. Avril?
Sure. If you have state-sponsored disinformation, there's obviously additional tools that you can bring to bear to try to address that situation, not the least of which is bringing together other countries to effectively, take action against them for the kind of campaigns that they're propagating. But but generally, I would say the disinformation, the line between disinformation and misinformation is not always an easy one to find. And the reality is, the greatest way to impact it, in my experience, is not to let it sit. So in other words, find your trusted interlocutors that are capable of saying, this is not acceptable, this is in fact the truth, here's the information. And I think the community of survivors is one example, but there's a whole series, employers, trusted faith leaders, variety of health workers, and so on, can be part of that. In addition, obviously, you want to work with the private sector and those who are spreading information generally, to see that they can bring things down that are in fact lies or false information that's being put forward as a way to minimize it. But having a source, a national source, an international source, other trusted sources, and really guiding everybody towards that information is one of the most effective ways to deal with a situation like that.
Great. I have Martin, Tim.
Avril, can we start with you?
Sure, I should take a few minutes to think about that. I do think that generally, and this comes out of our conversation that we've just been having, the areas that it seems to me require enlightened leadership, in a sense, is the issue of funding, right? And actually attracting greater funding to this issue. We all know that by spending money on preparedness now, we can save money later. And the fact that we don't have the mechanisms in place that allow us to more effectively address a crisis in the moment is critically attached to that. It does seem to me another piece of this is from my perspective, it's not a surprise, but it's certainly a takeaway from the discussion, is the need for greater communication mechanisms between the private sector and the public sector and the healthcare sector in actually trying to manage a situation and to best leverage each other's essentially resources under the circumstances. And I think that's a critical aspect of what has to happen, and one that, frankly, the current system isn't well positioned to do, because we frequently work through the public sector, and we have a variety of challenges in creating those sort of private sector and other industry, connections to what we're doing. Another piece of it that really didn't come up in the discussion, but from my perspective is another aspect of it, and there's far more experience and knowledge about public health issues in this room than I have, but it's. But those frontline health workers, the World Health Organization has talked about the enormous shortfall and that fact that they are utterly critical to identifying, detecting, and allowing for a response very quickly. And that's, sort of at the key. If we can do that quickly, then we can get to a possible answer, a vaccine, other countermeasures that need to be brought in more quickly. And so that's fundamental. And if we're able to establish communication networks that, as Tim mentioned, go both ways to allow us to both take advantage of, the opportunity to communicate outwards, but also to take advantage of the opportunity to hear from those frontline healthcare workers, we're going to be more effective. But we do need to train them so that they're actually capable of identifying the symptoms and issues that we should be responding to and developing those triggers. And I think that larger piece is sort of the most important part of it, is if you can actually create the preparedness systems, then you actually have a plan that triggers the investment that you need at the time that you need it and the communication that you need.
Time is going short. Sorry, quickly.
Check the video out for yourself as well. They talk about how they're going to move goalposts as people start figuring out that the virus in that simulation is not going to be, that it's not as lethal as people previously thought, that when people start being less afraid of it, that they were going to start moving goalposts, how they were going to have trusted sources that are going to collaborate with them to distribute news that they want. And they're doing that. Like every video that talks about the COVID-19 vaccine or COVID in general, they have a link to the CDC, or they have a link to Wikipedia that talks about what COVID-19 is. And look, I'm not saying that this is a bioweapon. I'm not saying that. All I'm saying is that they're using this, they're taking advantage of this to fulfill the agendas of private entities and elite figures like Bill Gates. And in the end, this woman, she appears to have had full knowledge of what to do in response to what's happening now with the pandemic. The plans they discussed in Event 201 talked more about how they were going to censor people. They're not talking about how they were going to have hospitals fully funded for this. And a lot of the stuff that they discussed in that event, again, this was over a year ago, October 2019. A lot of the stuff that they discussed are happening now. Anyone that talks about Event 201 or Operation Warp Speed, they're having their accounts taken down in platforms that are tied to intelligence and warp speed. YouTube is owned by Google. Google is owned by Eric Schmidt. Eric Schmidt has ties to these people. And he has also spoken about a technocratic, transhumanist great reset of America. And I just want to reiterate what I said in the beginning of this video. I'm not saying that Richard Medhurst, Gray Zone, I'm not saying any of these people are bad journalists. They are not at all bad journalists. I look up to these people. I admire them. They do fantastic work. All I'm saying is that I want them to think more critically about the news that's coming out about COVID, and to collaborate more with other journalists who are also doing fantastic work, like the people at The Last American Vagabond, Whitney Webb, Derek Bros. Why not have these people on your shows? I know this is a lot. This is a lot to unravel. I had a lot of notes. Again, shout out to Anthony Reyes. He did this research with me, and stay informed, people.